This video will teach you how to perform proximal jugular venipuncture in small mammals, which can be useful when working with both zoological companion or laboratory animals. Obtaining diagnostically adequate volumes of blood in small mammals is challenging. Peripheral vessels are small and easily collapse during sample collection. Larger vessels, like the jugular and femoral veins, can be used, but the position varies between species, and they have poorly defined landmarks. Cranial vena cava venipuncture can be used to collect larger volumes of blood and is best described in ferrets. The access point is located at the junction of the manubrium and the first rib. In this species, the cranial vena cava is elongated and the access point located far from the heart. A major downside with this technique is you cannot hold off the site, as you are accessing the vessel within the thoracic cavity. Considering the challenges of obtaining diagnostically useful volumes of blood, cranial vena cava venipuncture is often used in other small mammals, but this is risky, as the access point, the area of the manubrium in the first rib, is located close to the cardiac atria in species other than ferrets. Possible adverse effects include hemopericardium, cardiac tamponade, hemothorax, laceration of the heart or great vessels, or even death. Proximal jugular venipuncture is an alternative technique that permits collection of larger volumes of blood. It was initially described in hedgehogs, where the external jugular vein is accessed at the thoracic inlet, avoiding the need to enter the thoracic cavity. This technique utilizes palpable landmarks, and the needle is inserted at a notch formed by the insertion of the clavicle on the manubrium. The location of needle insertion is highlighted by the yellow X's, and both sides can be used for blood collection. Chemical restraint is required for the technique, typically deep sedation or anesthesia, and the skin is disinfected as with other venipuncture methods. For proximal jugular venipuncture in hedgehogs, the access point is at the junction of the manubrium and clavicle. Typically, a 27 gauge or smaller needle on a small syringe is inserted 90 degrees to the skin surface and approximately 1 centimeter deep. Negative pressure is applied with the syringe and the needle slowly retracted. When a flash is seen, one hand is used to stabilize the barrel of the syringe and the other hand is used to slowly retract the plunger to collect the sample. The technique is similar for chinchillas and rats, which have palpable clavicles, and the needle is inserted at the junction of the clavicle and manubrium. In this video of a sedated rat, the skin has been disinfected with alcohol. Flexion and extension of the ipsilateral shoulder joint can help you palpate where the clavicle inserts on the manubrium to guide needle placement. The needle is inserted 90 degrees to the skin surface and negative pressure applied. In this video, a flash of blood is not seen during initial retraction, so the needle is slightly redirected and reinserted. Once a flash of blood is seen, the barrel is stabilized with one hand and the plunger slowly retracted to collect the sample. After the desired volume has been collected, pressure is applied to the site to prevent hematoma formation. In species with vestigial clavicles, like guinea pigs and ferrets, the palpable landmarks are the manubrium and first rib. In this video of a sedated guinea pig, the needle is inserted 90 degrees to the skin surface. A flash of blood is noted, but the blood ceases flowing. Minute adjustments in needle depth can often produce a return of blood flow into the syringe. Proximal jugular venipuncture requires chemical restraint, is an alternative to cranial vena cava venipuncture, provides palpable landmarks, permits collection of diagnostically useful volumes of blood, and works across multiple species.